I'm not sure the order. Doctor, are you going to speak, do you think?
Yeah.
Come on up. This is Dr. Adams, local doctor here in Norwich. Okay? We'll just keep on here.
Well, we're all enjoying global warming this morning? Well, my name is Dave Adams, and I'm a dentist in this town. And I'm just going to speak on what's going on in my profession for just a minute, and you can see what you think of it. I have people come up to me every day, doctors and nurses and so forth, say, well, there's no dentists around anymore. What's happened to that? Why can't our children and our people get any dental care? Well, I can tell you a little anecdote. There's a garage around here right now where you can go in, give the guy $5, they put you in a barber chair, take it out, insert a pair of channel locks, or vice grips, or whatever he has. So we have socialized dentistry here. But why do we have such a problem? Why is it there? Well, a lot of it does come from the government. When Hillary Clinton was Mrs. President, she was in charge of managed health care. She closed 5 dental schools in this area. She closed George Washington, Fairleigh Dickinson, Case Western Reserve, one of the 2 programs at NYU, and one of the schools in Massachusetts. Up here in this area, we're short 800 dentists a year now. A lot of your high price and lack of supply comes straight from the government. They are managing the control situation. That's where it comes from. And as far as medical schools and nursing schools are concerned, they haven't expanded any since we only had 150 million people. We got 300 million people now. They haven't expanded them one bit. That's why there's a shortage. There's a shortage of supply. A lot of what you're seeing in price and ease of access comes right from the government. They're in charge of it. They're doing it. I'm going to tell you another little story that I had personally. I myself was in the hospital a while ago, not doing very well, and the doctor walked in and he said, well, you don't have health insurance, do you? And I said, no. Well, then I can write you a prescription for this. And he gave me a prescription that saved my life. That's why I'm here today. If I had health insurance, I'd be dead. Now, why does that kind of thing happen? Well, they just restrict the cost by restricting what they supply. I think there can come a time when you're going to find that so many things that are available to you now are not available in the future. The medication that I got was one called gentamicin. There's other ones out there called Boniva and Actinol and Fosamax. They're not going to be available under this new program. They're just not going to be there. The government won't supply them. Gentamicin is what I had, and that's the one that takes care of MRSA. Little children down in the hospitals in New York City are getting MRSA. If gentamicin isn't available, they're going to be in some severe trouble. And that's under the new health care plan. President Obama was on TV the other night, and he said, if your grandmother is 75 and she falls and breaks her hip, we're going to make a decision whether she gets a surgery or just a pain medication. We're talking about Demerol or morphine. These are not good choices. We live in a country now where at least you can, if you have to, go out and raise money. Maybe you have to mortgage your house, maybe you have to sell your car, but you can buy treatment people need. Under this new system, you're going to lose that. They're going to tell you what you can have and what you can't have. You don't have the choice of shopping around or going outside the system to get what you need. That's going to be lost to us. If this kind of thing happens, you're going to wish you had the old days back again. Maybe things were expensive, but you could get what you needed. Now under this new system, we're going to have to just take what we can get. That's what they call rationing. Does anybody have any questions for me?